I became very interested personally in physician well-being back in 2013 when I went back to a med school reunion in Toronto, which is where I trained, and found out that a couple of my colleagues had unfortunately taken their lives. And it really started getting me thinking about physician well-being and burnout for all the reasons that, a friend would think about this. And then over the years, I became interested in physician well-being from the perspective of a physician leader. We've always at Ochsner had a very bold strategic plan to address the needs of our patients and our community. And it seemed that physician well-being was a vehicle to execute on our strategy, and burnout was kind of an existential threat to achieving our goals. So really over the course of 2018, our chief medical officer and I saw a real opportunity for Ochsner's leadership to partner with the American Medical Association. And really, I remember honestly emailing Dr. Sinskey, Chris Sinskey, and Nancy and thinking, yeah, right, I'll be lucky to get an email reply. And I remember they replied, I think within an hour.
Our team had the opportunity to work with Ochsner Health and with Dr. G to support their strategy around professional well-being. We believe that the AMA is uniquely positioned to collaborate with health systems. We provide not only a validated assessment tool, but we are there as their bench strength to identify interventions, to help support the activities that they are doing within their own organizations to improve professional well-being.
The AMA was very helpful, to me at least, in articulating the business case and really being able for me to articulate the value proposition around well-being driving outcomes.
So what I would say to leaders is, if you care about quality, you care about burnout. If you care about safety, you care about burnout. If you care about financial stability of your organization, then you have to care about burnout, because burnout drives all of those. So their CEO and their CMO and the rest of their executive leadership team was present as I presented information about professional well-being, physician burnout, made the business case for why this was an important area for the organization to invest in, made the quality case for why this was important, which I think helped set the foundation of understanding, not only for the chief wellness officer, but for his colleagues on the executive leadership team. And once they saw that data, they recognized that this was not a side issue, but a core issue.
Really, we recognized that in order to really drive change, we needed to really understand if we were making a difference. So it seemed very important that we sort of measure the state of well-being and burnout, get a baseline assessment. So very quickly, Nancy and her colleagues were very helpful to help us put our first survey out. It was clear that they had some incredible tools to help us.
So at the AMA, we have a wealth of resources that an organization can turn to and use to guide their interventions. One of those is a set of online free toolkits called Steps Forward. We have over 60 different toolkits on very practical and actionable interventions, both in terms of practice efficiency and in terms of organizational culture and leadership.
We provide analysis, we provide resources, we provide leading edge research that helps these organizations not only lead their own initiatives, but also share their learnings and best practices with others.
And we just got our results back last month with our second mini-Z, and there were incredible improvements cited by our physicians and APPs in terms of their satisfaction with the EHR, that they were spending less time after hours doing EHR work. So I think that was really gratifying that, we were intentional in what our initiatives were and we're making a difference. I really want to see Ochsner be considered by 2025 the industry leader in physician well-being. Really deep down, I think everyone on our executive team feels that it's just the right thing to do for our physicians and our providers. And I think the AMA Joy in Medicine Award, that's going to be sort of our aspirational compass to make sure that we're heading in the right direction. And that's where I want to be. I think that's where the organization wants to be.